welcome to another edition of Health Matters.
And Health Focus.
I'm Anna Marie Sinatra.
And I'm Eva St. Marco, your practical nurse.
And together we bring you Focus on
Health Matters.
And I'm really excited today because we are at Lockport MRI, which is part of Western New York Imaging Group, which is one of our corporate sponsors. But before we go there, we're going to thank some of our other corporate sponsors.
Wings Flights of Hope with Joe DeMarco and his pilots, providing flights for people in medical need. Also, they provide for adults and vets and children.
Yes, they're pretty amazing. Those pilots stay on call 24/7.
Amazing.
To take people on a medical emergency flight. And we want to thank Matty Mattress from Mattress and More, where he has been educating us on so many things regarding mattresses. You cannot believe all the information, especially our holistic people who really enjoy hearing about the all-natural latex mattresses, which I now have one.
Ooh.
Yes, I do. Yes, I do. So make sure those pens and papers are ready. But before we get started, let me give you your healthy thinking tip. We're going to talk just a second about perception. Your perception belongs to you. However you're seeing things, and trust me, there's a million ways of seeing things, as we know, because everybody has a different opinion about something that's occurring in the world, right? So perception really matters for us to notice how we're seeing things and consider the possibility of seeing it another way. Just like the Franklin Covey picture of the old lady, young lady. We're going to pop it up on the screen for you right now so that you can see that half the people will see an old lady, the other half will see a young lady. And who's right? Everybody's right, because it matters how you're seeing things. So start to challenge your perceptions, your judgments, what you're thinking, and watch your world change. How about that?
Very nice.
Thank you.
Very nice. Very nicely said.
Thank you, from the practical nurse.
Yes.
Well,
Practical.
the practical nurse and the coach are going to take you on a wonderful journey about taking care of your health.
Can't wait. I've been excited.
All right,
So come on, join us.
Let's go find them. Eva, I am so excited that we are here at Lockport MRI with Dr. Frank Mascaro.
I am too, and I've learned so many things.
Really? Because I thought it was only me learning all this stuff being the lay person.
me the nurse that should know, right? But I have, really. It's been wonderful.
It has been so interesting, all the different imaging machines and the different times that you may need imaging and dyes and no dyes and contrasts. And I thought I was lost in some of the conversations trying to take my own little notes as we're always telling you to take the notes.
Yeah.
But it's good to know that nurses are learning stuff too.
Oh, yeah. There's so much to learn. It's such a vast, wealth of knowledge, because you can always learn with health.
Really good point. Very good point. So let's bring in Dr. Frank Mascaro, and thank you once again for your continued support. I just am always so grateful because we get so many comments about the programs that you are educating the community on so many different health initiatives and in a variety of ways. So thank you for that.
Well, thank you for coming to Lockport MRI, Anne-Marie and Ava. We feel that it's very important to be part of the community and get the message out about doing, normal healthcare maintenance, seeing your doctors once a year for your physical examinations, screening mammograms for our female patients that are 40 years of age and older, and also for other different various diseases that you might have a family history for. It's very, very important to get ahead of the curve and do your screenings to catch things earlier where we can make an intervention, where your physicians can help out and get you on the right path to health and recovery.
Yeah, I was just watching a morning program that was talking about all the latest cutting edge things that are going on with imaging equipment. And the person said, what's a shame is that the insurances don't pay for sometimes unless you don't know until something happens. And so I'm wondering, I was looking forward to us talking today because she was saying if people got screened more during their yearly, especially when there's family history, that so much more can be avoided.
Oh, you're absolutely right. People with family history, for instance, breast cancer. If a family member such as a mother or sister has breast cancer, you should be screened 10 years before their actual discovery of their cancer. So
Wow.
if your mom had breast cancer at 45, you should start screening at 35. And same with either a sister. It's got to be a first, direct relative of yours. So it's very, very important because, detecting early disease, be it cancer or other diseases such as, renal disease or hypertension, it's always important to intervene at the earliest possible moment to decrease the chances of doing end-stage damage to your, be it your kidneys or whatever disease that you're dealing with at that time. It's, I believe, very important to intervene at its earliest point, which really, when we're talking about healthcare and the expense of healthcare, it's actually less expensive to intervene at an early time than it is at a later time.
What
So,
an amazing point.
absolutely.
So how do we get this information to help to insurances that don't want to pay for this screening pre something happening?
I think it's very important for patients not to wait till they're not feeling well. A lot of people kind of, say, well, I feel good, I don't have to go for my physical examination, where they do some blood work, maybe a chest x-ray, an EKG, and that's kind of the earliest screen for detecting something. I think it's very important to do annual physical exams with your general practitioners and to be engaged with your general practitioner. And, making sure that your family history is known to your general practitioner so they can really kind of screen you for certain diseases that may be common to your family. And I think that is the most important intervention that we can do as individuals, as the patient, and to help our doctor really kind of set a plan for us to becoming healthy. I mean, that's the
Wow.
real important issue here.
How about you, Ava, with being a nurse, seeing so many different things medically?
Yes, that's true. I heard that too, like 10 years before. Too, didn't they say like certain BRCA genes too?
Absolutely.
Yeah.
Again, now we're paying more attention to when people have breast cancer, that we look at the cancer itself and does it carry certain markers. And then we can test the siblings or the offspring of that patient to see if they have a certain marker, a BRCA2 gene. And if they're BRCA2 positive, they're followed very, very closely because of the incidence for breast cancer to be increased in those patients. So again, it's about early intervention, taking care of our patients, taking care of our health at the earliest possible moment so we can get better results and have a better life.
And what about when it comes to heart disease too? One of the stories that I most recently heard at an event that I was at, a gentleman was talking about, I think he had a stent put in or something was going on, and he says the only way that he found out is he was doing some outside work and something fell on his chest and he cracked a rib, and so when he went for just a regular, would it be like a sonogram or something? I'm not even sure, you would probably know better. But he went for that to show the cracks on his rib, and it showed blockages and wound up having to have surgery that saved his life.
Wow.
Well, sometimes we call them incidental findings.
Yes.
That something happens serendipitously, something falling on the gentleman's chest, and all of a sudden doing a CT scan probably, where they saw some calcifications in his coronary arteries and saying, hey, wow, wait a minute, what's going on here? And then a cardiologist intervening and then saying, we probably do an angiogram, and they saw some narrowing, and they ended up putting a stent, which extends the life of the blood vessel to get more blood to the heart and back to normal, or at least as much normal as it could be, and intervening at an earlier point before there was total blockage and a heart attack would ensue. So these are the important things. That's why it's so important to follow up with your physicians, do your normal screening exams that are regulated and at certain age groups. I think that's the important thing as patients that we have to take part in. And not only, oh geez, I'm not feeling good now, I'll go see the doctor.
Right.
You know, there's a lot of information's out there. It's at your fingertips on the TV, the internet, in magazines. There's all kinds of prevention magazines that you can get so much information now. And I think it's very important that patients become interactive with their own health care.
And I don't know about you, but I know so many people, you probably know more than I, being a nurse, that don't even get their yearly physicals.
Right. They're not compliant. They feel that they don't need it. Why should I go? And unfortunately, health professionals are among those because I don't know if we feel not that we're above it, but we tend to neglect ourselves. We're okay. We don't have any symptoms. And people think that because they don't have any symptoms, they're in good health. That's not so. There are a lot of silent killers out there. And if you don't get it, then you're in trouble basically, because then when it does come, it's such a shock to people, but it's been brewing for months.
Right. It's usually more advanced.
Right.
And that's what makes recovery a lot longer. You go through so much more. Your body has to recover from such a more extensive disease than when you are able to intervene at a very early stage. That's why we all feel good. We kind of out of sight, out of mind kind of approach, but I think it's very important that we all are conscious that, you have one body and you have to take good care of it. You hopefully want to live a long and fruitful life. And to get that, at least to put yourself in the position to have that, is normal health care obstacle, that you want to avoid by not seeing a physician and not carrying out your normal routine health care.
And even those, we do a lot of interviews with people from the holistic field as well, and I'm always encouraging people, it's great to be holistic and use complementary therapies, and at the same time work with your doctors and don't use one in lieu of the other. Use them both together. We are such an amazing human race, with the technology development and the information about all the different complementary or alternative, if you're still using that word, but we don't want to use it exclusively. So getting those yearly exams, the mammograms, your screenings, your physicals, are so important, your blood work. Those are some of the markers that might give you a little bit of a heads up if something's going on.
I agree with you totally. It's people that do practice holistic medicine, I think, have to be complementary. I mean, they're usually very well read. They do a lot of research on their own. They know a lot of things about certain diseases and about certain holistic methods that can be incorporated into your normal healthcare plan. I think to do one or the other is not advantageous. And I feel that it's very important to really kind of follow out your maintenance health care and also follow some holistic practices. I think that would be the best of both worlds.
Absolutely. So I want to talk a little bit too about, we're here at Lockport MRI, where you just did an overhaul of one of your MRI. Here it may look like the same thing, but it's completely overhauled. And you brought someone along with you today too. So one of your other team members.
Sure.
So we can talk about this. This is your
Chief of Marketing, Marvin McKellar, who helps us out all throughout Western New York, and he's an integral part of the Western New York Imaging Group. And he's done a great job for us, absolutely.
That's amazing. Yes, I've been enjoying working with you as well, and you helped me with so much information, and you two got off on a whole conversation about stenosis and renal and inclusions, and MRI is for the soft tissue, and CT is the X-ray for the bones. And did I take good notes?
Pretty close.
Pretty close.
Pretty
Well,
close.
come on in and tell us a little bit about this new magnet, the 1.5, and how it differs. And
One thing I'd like to say is Lockport MRI is about having good access to good health care. And one of the things you really have to keep in mind is that it's the most important thing, is getting good imaging. And good imaging starts with the equipment and the techs and the radiologists who read it, and everybody involved in the process, from your doctor sending you to an outpatient facility like this, which is in a comfortable, nice environment, as opposed to other scenarios where you're going into a very sterile environment. Here, you have nice furniture and real pleasant people to greet you. And also, we have the latest in equipment with the latest technology available. We're able to do things that simply other companies and other radiology companies cannot do, or are willing to spend the time in all the beta testing to achieve. One of the things that we do here is non-contrast runoffs, non-contrast renals, non-contrast MRIs of the brain, MRI, we call them MRAs, non-contrast carotids from the top of the arch to the base of the skull. These are all very important, and they come through crystal clear. And these images are made available to the radiologist to get the best possible reads, to detect stenosis in the earliest possible stages. And that's what's important, because early detection is the better part of the cure.
Wow, amazing.
What's really important, like Marvin said, our population, not only in Western New York, but across the country, we have people with diabetes, hypertension. So their renal function is decreased. Hence, to do something with no contrast does not put a taxing load on the kidneys that are already compromised due to the renal disease. Now, also people with hypertension, diabetes, have calcifications in their coronary arteries of their heart and their carotid arteries in their neck. So basically, we have to make sure that their blood flow to the brain, the heart, and their other organs is viable. So these are important tests to have done, and we can do them now on our equipment without the using contrast, which could be very taxing on an already compromised kidney function. So this is very important to our population.
Wow, and that's since this new machine, or the new upgrade.
Exactly.
Interesting. And I completely hear that, because I am one of those people who have a very sensitive system, who've had reactions to some of that, as you well know.
Yes.
Yes, yes.
And when it comes to contrast, we use some of the best contrast out on the market today. We don't use just the generic contrast. We use contrast in our liver scans that will get pre and post scan. So you'll go into the MRI after being injected with the contrast to get one scan, and 20 minutes later you get a secondary scan, and that will get your pre and post lesions. The importance of that is it's never been able to be done before, and with contrast agents that we're willing to use, you're getting the best that's out there today.
Wow, pretty amazing. You spare no expense to achieve the highest level of MRIs available, as well as the material that you're using.
Correct.
Absolutely.
I think it's very important. When patients come to us here at Lockport MRI or any of our Western New York imaging group, imaging centers, their physicians as well as the patient need to know what is the next step. So we have to give this information back to the physician so they can discuss with the patient what is the next step.
And I
How do we go
understand
from
you
here?
do that in one day, by the way.
Oh, absolutely. Our turnaround times are same day, probably less than a couple hours.
Wow.
Absolutely. And if it's something urgent, we will call the physician directly to get that information right to the physician so they can talk to their patient and set
Save
up
a
a plan.
life. Save a
Absolutely.
life. Save a
Absolutely.
life. Well, you know, it's always such a pleasure to come and talk with you. We're here now at Lockport MRI, and we've been to Western New York MRI on Genesee Street, and PET CT on Genesee Street, and Kenton MRI, one of my favorites, because it's an open MRI if you're a little claustrophobic.
That's right.
And you're in so many other facilities that people aren't even aware of.
Right. We have a plan to be an outreach type company where we can get to the patients and to make it convenient for the patients. So, you know, like everybody says, like Ava alluded to earlier, people out of sight, out of mind, but if you make it convenient for them, hopefully they'll take that step to, you know, check up on themselves. Say, you know, I really needed to do this, and you know what, it's just around the corner. I mean, I think that's very important to get people in, to get them screened, and make sure they're healthy. That's, I mean, for us, when people have a healthy scan that we find nothing and everything's crystal clear and perfect, that's great. That's what we want. And to tell that patient, boy, what a relief. You know, they weren't feeling good, well, it was maybe something different. It's not something that's really devastating or something that they would be really, really worried about.
Wow.
So,
Well, we're going to go back and talk with Tammy, your lead tech, and she's going to show us your imaging equipment and talk a little bit about how it's done and how comfortable it is here so that people can feel a little bit more knowledgeable, because that information is power.
Knowledge is power.
So let's go back and find Tammy. And we're with Tammy, who's the head lead tech, who is actually the person that you'll see when you're in having an MRI, and she's watching people right through the window and helps to keep you nice and calm. And tell us all about this new MRI imaging equipment that's here.